So, good morning, good afternoon, or good evening to everyone joining us for different parts of the world. Today's section is dedicated to a very important topic, the mental health and the well-being of caregivers who support people living with bleeding disorders. The webinar will be conducted in English. We also have French and Arabic translation available for you. I will show you soon how to do it. We are very happy to have you with us for this meaningful discussion, and we are joined by wonderful speakers who will share their experience, insight, and practical strategy to better support caregivers. So let's start it. Here is how to choose your channel. If you're using a cell phone, please take a look in the three dot in the bottom of the cell phone. You have to click here. You have to find and choose the language interpretation. And then you have to choose the channel that you'd like it to listen the webinar. So we have English, we have French, and we have Arabic. Please, you can do it. If you are a panelist, you can choose the English one since you are going to speak in English. When you have the cell phone, this is the screen that you see it. But if you are using a computer, sometimes you can see the three dots and say more, or sometimes you have this button in the bottom of the screen saying interpretation. You can click here. You can see all the channel available for you. In our case, English, French, and Arab. Please choose the language that you'd like it to listen, and then you also have optional to mute the original audio. So my name is Ciani. I'm the Medical Education Manager at the WFH. It's a great pleasure to welcome you to today's webinar organized by WFH Psychosocial Committee. On behalf of Dr. Assad, Director of Humanitarian Aid, and Jason Martin, Dr. Jason Martin, Head of Humanitarian Aid and Medical Training, I would like to thank our speakers for taking the time to join us and contribute to this important discussion. The WFH does not promote any particular pharmaceutical product, and any mention of any commercial brand is this presentation is strictly for education purpose. Today we have two panelists and the moderator. The moderator will be Sarah Wiftaker, clinical psychologist in UK. We have Mosena Olaf, psychosocial socialist, and Patricia Cabré, Pedagoga Therapeutic Association Catalan de Hemophilia, Spain. Sarah.
Thank you so much. And yes, welcome everyone. I'm very happy to introduce our two panelists today, who are wonderful members of the Psychosocial Committee and also excellent psychologists in their respective countries. Senna's from Mauritius and obviously Patricia's from Spain. We'd love to have your input, your questions, comments, reflections. We're going to ask if you could write those ideally in the Q&A section or in the webinar chat, and then we'll save those questions for the end. But I'll be keeping an eye on those as well. So any thoughts that come into your head, pop them in and we'll have some time at the end. But yeah, so I think we'll be starting with Senna, who's going to be talking about psychosocial care in healthcare teams.
Okay, so
Super. Dana, take it away.
Yes. Thank you, Sarah, for the introduction, and thank you, Sian and the WFH team for the opportunity for us to present the psychosocial team to present this webinar. So I would like to share that I presented the same material at the CCS summit this year in Dubai, and I have been invited again to present it for this webinar. So it will be on how to work with the comprehensive care team and how to maximize care with resources available. Next slide. Next one. Okay. In my next presentation, you will see that I'm merging my NMO, the Hemophilia Association of Mauritius. I would like to share my connection with the association and how, through the NMO, we have introduced psychosocial care to our members, to our patients and the families. So a little bit and a little overview of the Hemophilia Association of Mauritius. So we were established in 2008 to address the need of patients with hemophilia and related bleeding disorders in Mauritius by a group of patients, parents, and healthcare professionals. Next one. So prior to 2008, we had a lot of challenges for the hemophilia care in Mauritius. There was inadequate treatment, there was lack of laboratory facilities, no healthcare professional awareness, high morbidity rate, social stigma and isolation, limited advocacy and support, no comprehensive care, and no hematologists. Next one.
Sorry.
Yeah. So over the years, HAM, the Hemophilia Association of Mauritius, has worked tirelessly with a multidisciplinary team, and here are the achievements. So there's an improved health outcome, enhanced quality of life, collaborative care, increased patient engagement, and access to resources and support. Next one. Next one, please. So the importance of the multidisciplinary approach. A multidisciplinary team consists of professionals from various fields who collaborate to provide comprehensive holistic care for patients. So each member brings their expertise to address all aspects of the patient's health, including physical, emotional, social, and psychological needs. Next one. So to understand the psychosocial care, I will just give you a little explanation. So the psycho part is the psychological characteristic. These encompass emotion, thoughts, attitude, motivation, and behaviors. And the social part, the social aspect, refers to how the person connects with and interact with their environment, including their sense of identity, relationship, and living situation. Next one. So the importance of the psychosocial care, why it is important? It is important to enhance emotional well-being. Addressing psychological aspects help reduce anxiety, depression, and stress, leading to improve overall mental health. And then there's better treatment adherence. Patients who receive psychosocial support are more likely to follow their treatment plans as they feel more empowered and informed about managing their condition. Next one. So there's an improved coping strategies. Psychosocial care equips patients with tools to cope with challenges of living with a chronic condition, enhancing their resilience and ability to handle stress. Also, there's a stronger support network, facilitating connection with support group and community resources, foster relationships that provide emotional and practical assistance, improving the social well-being. And there's the holistic care approach as well, which when integrating psychosocial care into treatment, plans ensure that both physical and emotional health needs are addressed, leading to comprehensive and effective care. So the role of the psychosocial support in comprehensive care. Next slide, please. So what is the role of the psychosocial support in the comprehensive care? Psychosocial support plays a critical role in assisting individuals with hemophilia in adapting to the condition and navigating daily challenges. So who are the professionals in the psychosocial support? So you have social workers, psychologists, counselors, and it is essential to deliver support for our patients. And the holistic approach is another, which is very important because medical treatment is vital for managing bleeding disorders. We all agree to this. It is the integration of medical care with psychosocial support that significantly improves the quality of life for individuals living with condition. So this is the blend for the holistic approach, medical and the psychosocial part. Next slide. So integrating psychosocial care into the comprehensive team. The NMO and HTC, usually it is the HTC in many countries, but in my country, it's the NMO also who plays an important part in the psychosocial care. So the strategies for the NMO and the hemophilia treatment centers to better integrate psychosocial support into their services is to have routine assessment, like implementing regular psychosocial assessment for patients to identify their emotional and social needs, ensuring timely support and intervention. Educational workshop, which is very important. It offers workshop and training session for patients and families on coping strategies, stress management, and navigating social challenges associated with hemophilia. Support group. This is facilitated through peer-to-peer support, where individuals and families can share experiences, foster connection, and receive emotional support from others facing similar challenges. Then you have the resource accessibility. The NMO, the HTC will provide resources such as pamphlets, online materials, and referral services. Collaboration with community service, partner with local organizations and mental health services to create a network of support that patients can easily access. And also the feedback mechanism. So you establish channel for patients and families to provide feedback on psychosocial services, allowing for continuous improvement and adaptation of support program. So by implementing these strategies, the NMO and or the HTC can enhance the overall care experience for individuals with hemophilia and their families. Next slide. So I will just go rapidly through a case study in Mauritius. The NMO we have established in a community outreach. Next slide. So a community outreach project. So from 2008 to 2015, we had 52 patients registered in Mauritius, that they were registered in Mauritius at that time, from 2008 to 2015, 52 only patients. So in 2015, we started the outreach program. And the objective for the outreach program was to spread information for early detection of bleeding disorders, encourage families to seek help and join support group, create a favorable environment for patient integration, and work with the multidisciplinary team. Next slide. So the methodology for the outreach program was to do home visit to identify undiagnosed relative through the family pedigree. So each family were visited and they had a family pedigree, and we were able to identify patients who might have hemophilia. So referral of suspected patients for diagnosis and treatment. So we refer these suspected patients to the laboratory for testing. Then follow up with healthcare providers on patient health status. We did counseling and psychosocial therapy for coping. Workshop for healthcare professionals on symptoms and referral processes, and regular awareness session for the public. Next slide. So the result, we had increased awareness and early detection. So the outreach initiative led to greater public awareness of bleeding disorder, resulting in earlier diagnosis and intervention for affected individuals. Enhanced support network, community outreach fosters the creation of support group, allowing patients and families to connect, share experiences, and access resources. There was an improved education for families and patients were well informed about hemophilia, how to manage hemophilia, which empowers them to make informed decisions and effectively navigate treatment options. It strengthens relationship with healthcare providers. So outreach program can bridge the gap between patient and healthcare professional, leading to better communication and coordinated care. There has been also an increased access to resources. Community outreach has facilitated access to treatment, educational material, and psychosocial support services, improving overall quality of life of individuals with bleeding disorders. And our number of patients in 3 years has increased by 50%. So these are our results of outreach. It was a combination of identification of new cases, but at the same time on psychosocial care. Next slide. So strategies are how to maximize care with resources available. Just to let you know that in Mauritius, we are a small country in the Indian Ocean. We have only 1.2 population, and we are a small island, so we have to our treatment, our project, everything comes from abroad. So we are very isolated in the Indian Ocean. We do importation, etc. So we are a very resource limited country. So how we as a small country, unlimited resources, how we have been able to introduce the psychosocial care. So I will just go overall access. You have to assess the available resources. This is what we have been doing. So conduct an assessment of all resources available within the healthcare facility, including staff expertise, technology, and community partnership. Recognize area where resources may be insufficient or underutilized, allowing for targeted improvement. Next slide. Optimize. Next one. Yes, thank you. So optimize human resources, assign tasks based on each team members, strengthen expertise. Sorry. So you have to assign tasks based on each team members' strengths and expertise to enhance efficiency. Encourage team members to gain skill outside their primary roles. This not only builds versatility, but also ensures coverage during staff absences. In our case, at the Hemophilia Association of Mauritius, we hired people from social backgrounds to fill the gap in what the government can't provide. Psychologists and social workers are quite limited in our government hospital. So this approach foster strong collaboration between the NMO and the healthcare professional. So implement care pathway. Develop care pathway for common conditions to streamline treatment processes. This helps ensure that patients receive timely and consistent care. So you will see that the accompanying image illustrates our treatment guideline protocol, which has been developed collaboratively by the comprehensive care team and the association. So this we have to find ways to get in the system. Prioritize prevention care. Equip patients with knowledge about preventive measures. Next slide, Sian. Next one. Okay. So equip patients with knowledge about preventive measures and healthy lifestyle choices, empowering them to take charge of their health. So prioritize the preventive care by equipping patients with knowledge about the preventive measures and lifestyle choices, thereby empowering them to take charge of their health. Next slide. So we have to engage community resources, collaborate with local NGOs to provide support services, create a referral network for patients to access other services, financial assistance, for example, broader health needs and poverty. So in our case, we have network with other NGOs, with government bodies. We refer our patients to these NGOs whenever they need more assistance. Next slide. So monitor and evaluate resource used by utilizing data to analyze treatment, outcome, and resource utilization, which help identify trends in patient care and areas that needs improvement. Next slide. Advocacy. So present data on treatment outcome to health authorities to advocate for resources, treatment, and any other area of the gap analysis. Next one. Advocate for funding and support. So explore funding opportunities and from local and international health organizations or partnership with pharmaceutical companies to secure additional resources for patient care. Just to give you an example, for us in Mauritius, we do the home visit to our patient, but sometimes because we are too involved with the association and the patient, sometimes patient needs to talk to someone independent that is not involved with the family, with the treatment, etc. So we look for funding and we pay private psychologists. We refer our patient to these psychologists so that they can talk independently with someone neutral. So advocacy is important, funding is important for the support. Next slide. So by implementing these strategies, multidisciplinary team can enhance collaboration and improve outcome while efficiently utilizing available resources. This approach addresses immediate healthcare needs and establishes a sustainable model for future care delivery. Next slide. So I thank you very much for your attention, and I hope I will have some questions later on. Thank you.
Thank you very much. Well, for our next panelist is Patricia.
Brilliant. So there are definitely a couple of questions, Senna, so we'll come back to those at the end. And please do continue to put any questions you have in the chat, in the Q&A section, either for Senna or for Patricia as well. Good. It's lovely to hear about the collaboration you're doing with the NMO particularly. It's great. Cool. Sunny, are you ready?
Okay.
Fab,
Good morning.
Patricia, go.
Thank you. Good morning, good afternoon, good night. Thank you for being with us today. I am Patricia, and I am working as Service and Programs Coordinator of the Catalan Association of Hemophilia located in Barcelona. Today, I am talking about a psychosocial network for family caregivers where we are involved. Next. In my city, Barcelona, there is a citizen agreement for an inclusive Barcelona, a space created 19 years ago. It promotes participation and public and private cooperation with the objective to build a more inclusive Barcelona. As of June 2025, we are 900 NGOs, services, and institutions working together in different networks. Each one is focused in a different social issue, like, for example, labor inclusion, immigration, homelessness, children's rights, social inclusion, or accessibility. Today, we will explain how we work in the network for supporting family caregivers. Next. This network is made up of 25 organizations that differ in size, nature, and objectives, but share a common purpose, ensuring that all people who care for sick or dependent family members receive the recognition they deserve and the support they need. Next. This network is made up of 18 NGOs specialized in issues related to various diseases such as stroke, cancer, Parkinson, mental health problems, multiple sclerosis, or hemophilia, like our organization. It also includes 5 professional associations of doctors, nurses, social workers, psychologists, and pharmacists, as well as 3 public institutions. We meet regularly throughout the year and strive to promote different projects. Next. In Barcelona, there are more than 350,000 people who take on the responsibility of caring for someone. 1 in 5 older people lives alone. 21% of the population is over 65. Almost 30% of domestic and care workers lives in poverty. 1 in 4 women is engaged in non-professional caregiving. Wives, daughters, mothers, sisters, and daughters-in-law are the ones who bear the burden of this unpaid work. And these tasks affect their physical and mental health, their personal and professional paths, and their current and future economic situation. These figures show the urgent need for a fair, sustainable, and shared care system to acknowledge the invisible work. Next. In addition, we are very aware that beside every person who is ill, growing older, or losing the ability to care for themselves, there is usually someone who looks after them, and that person also needs support. Next. The objectives of our network are promote and monitor the strategy to support family caregivers, recognize and give visibility to the work of those who care for their relatives, defend family right to provide care and assurance that their needs are included in the public agenda, raise awareness of support organizations, and engage and collaborate with different professionals to jointly improve care and support for family caregivers. Next. One of the most relevant initiatives we carried out is Barcelona Cuida Space. It is a municipal service located on a very central street. It offers information, guidance, and emotional support to caregivers. It helps with, for example, dependency procedures, labor rights advice, self-care resources, and emotional support. It is a free and open access, and no appointment is needed. Next. Another important initiative is the Caregiver Card. It recognizes and values care work and provides access to rest and well-being activities, personalized support and training, discounts on culture and health services, and social recognition actions. Today, there are over 9,000 users of this card, and people can apply for it at Barcelona Cuida or online. Next. And finally, I want to introduce you today a publication we made called "And You, How Are You?" This guide was developed by our network with contributions from over 170 professionals and caregivers. The goal of the guide is to ensure caregivers receive the recognition and the support they deserve, with guidelines for supporting family caregivers addressed to social and health service professionals. And all starts with a simple but powerful question. And you, how are you? Next. We made this guide because every patient is usually accompanied by a caregiver. Caregivers face emotional, physical, and social challenges. Professionals play a key role in supporting them, and we wish to provide orientations for health and social service professionals. The guide aims to highlight the key aspects that characterize the situation of the caregiver and recommend some guidelines that professionals may consider when supporting caregivers. Next. Caring is usually a long process that goes through different phases, and each person experiences it in different ways. The nature of the illness, its prognosis, the intensity of the care needed, the available support, the caregiver's personalities are some of the factors to consider. But beyond the difference, this guide aims to outline the common elements of each of these stages. The caregiver to be, when the person navigates from uncertainty to the diagnosis. The active caregiver, when the person is recognizing oneself as a caregiver. And the invisible caregiver, when the person needs preparing for a new stage after experiencing loss and grief. Next. Being a caregiver is a role that may develop gradually over time. For some people, receiving a diagnosis comes as a shock. For others, after weeks or months of tests and consultations, finally obtaining a diagnosis can bring relief. In any case, it is a process with a profound emotional impact. Reactions of fear, sadness, anger, and distress are common. At this stage, the caregivers are often the great forgotten ones and rarely have the space to share what they are experiencing and how they feel. Access to information and guidance is key at this stage. Next. The most important guidelines at this point are: acknowledge the caregiver from the very first moment. Include them from the first visit. Ask them how they have experienced the process, how the family is organizing care. Make them feel that no matter how the process unfolds, they will not be alone. Provide clear and understandable information, because information reduces anxiety and promotes understanding. Use plain language, clarify doubts, allow them to ask questions. Respect their timing and pace of assimilation. Remain accessible, because accepting a diagnosis is a process and information is rarely assimilated all at once. Provide opportunities for them to return to you with questions or concerns. Make time and space for them. Ask how they are coping. Caregivers often reply, "I'm fine," but if you wait for a minute, they may add, "But I haven't slept, I am exhausted." Help them to recognize what they are feeling. Next. Welcome their first emotional reactions without minimizing them. Give them space. The acceptance of a diagnosis involves a rupture of expectations, a grief process due to loss of health or future imagined with a child, for example. Fear, anxiety, sadness, and anger are natural feelings. Validate their emotions and let them know they are allowed to feel them. Anticipate care needs. Be proactive. Help them prepare for the stages ahead to reduce anxiety and uncertainty. Understanding disease progression helps caregivers. Behind every diagnosis is usually a group of people trying to cope. NGOs offer important support and information for both patients and families, and find spaces to process the impact of working with caregivers. At some point, you will tell them they need care for themselves in order to care for others. Apply that same principle to yourself. At this stage, no, one before, previous.
Sorry.
Yes, at this stage, the active caregiver is already aware of their new responsibilities, but often not of their own need of support and care. This stage is marked by great emotional complexity and contradictory feelings. Important changes occur in relationships and environments, in family, social work, and this phase can last a long time, depending on the illness and its prognosis. Professionals should acknowledge caregivers, promote self-care, simplify processes, and connect to resources. Next. This stage, as we have seen, is characterized by a strong emotional impact. There are a lot of feelings, such as, for example, isolation or loneliness, guilt for not doing enough, for believing they did something that caused the illness in case of hemophilia carers, for example, or for not being available to other family members. Resentment toward relatives who do not share responsibilities or offer support. Exhaustion, fatigue, burnout, anxiety, worry, and fear about not knowing how to manage responsibilities, uncertainty about the future, and sadness because the loved one's condition or because abandoned future plans or professional or personal goals. Self-neglect because caregiving tasks take precedence over personal ones. And it's difficult to ask for accepting help because a lot of caregivers think, who can do it better than me? Next. Caring also strains the couple relationship. Lack of time together, reduced communication, fatigue, stress. The couple may experience the illness differently, generating misunderstandings and conflict. Still, many couples get stronger in the end. The ability to communicate about practical matters and emotions, to say what they feel and how they are coping is key. Next. The most important guidelines at this stage are: ask about their well-being. How many hours do you sleep, for example? Small questions can help. Create a trusting environment for open conversation. Encourage them to express worries and feelings. Avoid telling them what they must do or feel. Instead, validate emotions. For example, I understand you feel tired, sad, overwhelmed. Can you think of something that may help you feel better? Remind them they have the right to happiness. Help them recognize positive aspects and give themselves permission to enjoy daily life. Caregivers need to care for themselves emotionally and physically to continue caring others. Encourage them to take breaks, walking, exercising, etc. Acknowledge their role and skills. Involve them in treatment decisions and make sure they feel recognized. Work together when possible with the caregiver and the patient. Next. Provide practical tools and guidance. Help them with concrete tasks, managing appointments, medication, care routines, nutrition, or behavioral changes. Inform them about caregiver support groups. These groups allow caregivers to share experiences, reduce isolation, and receive emotional support. Convey trust. Caregivers need to know their loved one is in good hands. Reassure them about the quality of care provided by your professional team. Make things easy. Simplify procedures, speed up processes, and anticipate resources they may need. Watch for signs of overload or breakdown. Request for help often comes at a crisis point. Anticipate needs early to prevent harm to both patient and caregiver. Be alert to caregiver incapacity and risk of abuse. Overload, depression, substance abuse, illness, or pre-existing conflicts can create risks. Prepare them for loss and grief. Address important issues before the final stage of the illness to reduce conflict and prepare for painful decisions. And finally, find a space for your own emotions as a professional. Supporting caregivers means receiving the impact of their emotions. Reflect on how this affects to you. Next. In the stage of loss and grief, it's difficult to identify common elements. Not all grieving processes are the same, and they must be addressed in different ways. There is, however, a shared loss, the caregiver role, which needs to be processed. It is a turning point. It requires reorganization. At this stage, there is often a change in social perception. They are no longer considered a useful resource. They become more invisible. Normally, they are no longer regarded as subjects of policies, programs, or support. Next. There are significant differences depending on the reason why the person stops being a caregiver. When the person cared for improves or recovers, the caregiver may remain anchored in the protective role. Support is needed to guide them toward greater autonomy and a new stage. Admission to a residential facility is a kind of loss, often accompanied by intense grief. So it is a major change. It does not mean that the caregiver role has ended. Finally, sometimes death may be seen as a release, but telling a caregiver, now you can rest, is never helpful. Caregivers' personal traits, history, and beliefs are key in shaping emotional responses to death. Shared grief is vital. Crying, talking, and remember the loved one is therapeutic. Next. The most important guidelines in this stage are: do not disengage from former caregivers. Stay in touch and provide support respecting their own time. Help them express their pain and make sense of it. Support them in managing and naming emotions, acknowledging their suffering. Remind them these feelings are part of the process and it will not last forever. Learn to tolerate their fears and sadness. Acknowledge the good work they did. Highlight their contribution. Support identity rebuilding and social reconnection. Encourage them to rediscover themselves, to reconnect with relationships, to return to activities once set aside, and recover self-identity. Inform them about available resources. Grief support groups and other community spaces can be emotionally restorative. Watch for signs of complicated grief. Grief is not a disease, but symptoms like profound sadness, depression, disrupted eating, or sleeping habits may indicate pathological grief. Work on your own grief as a professional, because to support others in these situations, it is important to recognize your own vulnerability to suffering and death. Next. This guide and networking work are an invitation to look beyond the illness, to see alongside each sick person there is another who accompanies, supports, and cares for them. Until each and every person who cares for a sick or dependent family member receives the recognition they deserve and the support they need, we will keep working. Thank you.
Thank you so much, Patricia and Senna, as well. Thank you again. They were two really, really interesting talks and covered some lovely topics. We do have a couple of questions in the Q&A, so if I just start with those perhaps, and if anyone else has any questions they'd like to ask, if they can pop them in the Q&A. It might be possible to ask a question live if you raise your hand. It looks like I might be allowed to let you talk, but I'll start with these. I think this one came when you were talking, Senna, although either of you could answer, from Anthony. How would you differentiate between comprehensive care and holistic care? Any thoughts on that?
Okay, thanks, Johnny, for that question. In fact, I would like to say a little word Tony and I, we had a long discussion for some times about this holistic care. So just when we talk about the comprehensive care, it's really about making sure that all medical needs are met and that everyone in the healthcare system is working well together. However, when we talk about holistic care, it takes a step further by looking at the person as a whole person. It considers the physical health, of course, the feeling of the person, the spiritual, and the overall well-being of that person. So instead of just focusing on a specific illness, holistic care, it aims to improve your entire quality of life. So you will see I've put a lot of holistic care in my presentation because as a psychosocial person, I want to look at that person as a whole person and not just bit and pieces. So that's my way of seeing holistic care. I don't know if any one of you would like to add from what I've said.
I think that's a really good differentiation, but how they overlap as well. Patricia, have you got anything to add to Senna's answer? Oh, you need to unmute.
Yes.
There we go.
No, I think she has explained really easy, no? For me, comprehensive care focuses on a thorough examination of all relevant factors, while holistic care emphasizes the interconnectedness of all parts and considers the whole system. No? I think for me, this is the difference.
And I think, Patricia, you talked about the holistic care by recognizing all the kind of breadth of organizations that are kind of coming together and pulling together in Spain, and just how amazingly broad that is. It's a wonderful approach.
Yes, we make a network between different entities, no? Yeah. And we try to think in the caregiver. The situation of the caregiver can be similar in different illnesses, in different processes. Although everyone is different, no, you have a common aspects that you can take it into account.
Absolutely, well said. Our second question in the Q&A, again, I think it happened when Senna was talking, but we can all have an input. What are your thoughts about a person-centered approach to holistic care for persons with bleeding disorders?
So using the person-centered approach in holistic care, it really makes a difference to the people with bleeding disorders or any other illness or any other chronic disorders, because it's all about involving that person in their own care and recognize what they need and prefer. We are talking a lot about shared decision making, etc., but to use a person-centered approach in this type for the patient, the person, he can decide on his medical, it is very important. So the person, it's not just about focusing on the medical side again. You consider about that person feelings and even mental health. So when we keep the line of communication open, it builds trust, it empowers that person to take like an active role in his health. So for me, again, this can lead to better outcome and overall a happier and healthy life for that person when he's in the decision making of his health by using the person-centered approach with the team.
Thank you, Senna. Patricia, any additional thoughts on that?
No, I think she explains clearly.
Yeah.
For me, a person-centered approach to holistic care for persons with bleeding disorder emphasizes the importance of considering the individual's unique needs, preference, and goals. No, it's the authentic person. No, this approach allows patients to actively participate in their care, fostering a collaborative relationship between patients and health providers. For me, this is the important question.
Yeah. We've got those are all the questions in the Q&A at the moment. I had one that I might be sneaky and ask now, whilst people just have a few moments to see if there's any other questions in their minds before we finish. I was just wondering, Patricia, but Senna, I'd be interested in your thoughts as well about whether there's any, how do you work with people for whom perhaps family beliefs or religious or cultural beliefs might make it hard for them to even see themselves as a caregiver, perhaps, that they don't identify as that, and that might be a barrier to them being able to even recognize a need for help or ask for it. Have you come across that, and if so, what are your ideas for working with it?
Yes, this is a key point because sometimes the needs of the person who needs the care are the important ones. You see the hemophilia children, for example, but you did not see you as a person who needs care, no? Because you are focused on your family and in your family member, but not on you. So this is a process, no? And for this reason, we invite people, professionals of health system and social system, to recognize the caregiver too, and tell them, you need help too. You need to take care for yourself. I count on you to take care of the person who is ill, because you are very important part of the process, but you need help too. For this reason, I think it is important that, for example, NGOs like the work that we make in the association, no, recognize the families and recognize that they need to be part of the programs, no? For example, the group of parents or the psychosocial or individual interviews or the psychological attention, no? There is different programs that are focused on the caregivers, because they need to be recognized as themselves as a people who needs care too.
Yeah. Thank you, Patricia. Senna, have you got any reflections on your work with?
Whatever Patricia has been saying, it's same here in Mauritius, but also with being small country, all people know each other, so it's difficult for them sometimes to disclose that they are hemophilia. They will disclose or not disclose, things like that. So that's one of the reasons also that we have come up with this outreach program. So we go to the family and talk to them. They do come to our education program, etc. But when we have this personal touch with the family, with the individual, it makes them, they have more trust, they have more to come forward and say, yes, I need help. I need help on this. I don't know this, what to do in case of this. If I go to work, I don't want to disclose how it will be perceived, extra, things like that. So the connection is easier when we have been doing this outreach program for us.
Thank you. Well, I think that's probably it in terms of questions from the audience as well. But can I just say thank you so much to our panelists again, Patricia and Mosenna. Thank you especially to Sienna, who is in the middle of her night and has broken her important sleep to come and help from a technical position, which is great because I couldn't have done it. And also thank you to our translators who've been working diligently in the background to keep everyone able to make sense of what we're talking about as well. And thank you to you attendees. Thank you for coming and participating. And any questions or follow-ups, please do email Sienna. Her email's on the screen and she'll pass them on, and we can hand out the slides as well if requested too. Have a lovely rest of your day, evening, wherever you are, and we look forward to seeing you next time. Thank you.
Thank you, Sarah. So if you have any question, you can just send me an email, and I be a pleasure to send for the panelists for today. And okay, that's it. Thank you very much. Have a nice day. Bye bye.